Good afternoon, everyone. Welcome to this expert panel on COVID-19 community questions, which has been made possible by a partnership between the Center for Healthy Aging at CSU and CSU Extension. My name is Allie, and I'm an admin here at the center, and I'll be your host for today's session. The Columbine Health Systems Center for Healthy Aging serves as a catalyst for the interdisciplinary research, evidence-based outreach, and education about healthy aging. As a community-engaged center, it is our goal to be a trusted resource for discovery and application of research during this crisis and moving forward. So we hope this webinar is helpful to you and would appreciate your feedback on the content and subject for future webinars. I'll be dropping my email in the chat after we get started. So if you have any questions, you can always feel free to just send me an email. We're thrilled to have a panel of experts from a wide variety of different departments and to help bring you the latest science and medical-based approaches for keeping you, your loved ones, and the people you may serve in your communities as safe and informed as possible. One of the challenges we have all faced during this recent pandemic is how to navigate the changing and often conflicting information coming to us from different sources. Added to this is the difficulty with balancing changing policy and guidance with preserving the vital relationships and services for older adults in Colorado. We hope we can bring you evidence-based answers to your questions today. A few housekeeping items before I introduce our expert panel. Please be sure to mute your microphones so that any background noise can be reduced. We are recording the event, so if you want to view it again or forward the link to friends and family, you can certainly do that. During the last few weeks, we reached out to various stakeholders to ask what questions you have for the experts at CSU, and for those of you who replied, thank you. We compiled that list and we'll go through each of those questions. For those joining us that didn't have a chance to respond, you can ask your question in the chat function during the first portion of the webinar. We'll get through as many of the live questions as we can. If we run out of time, we've just been popping the answers in the chat. I also want to share that this webinar is intended to provide general information and discussion about health and related subjects from our panel of experts. The information and other content provided here or in any linked materials are not intended and should not be construed as personal medical advice, nor is the information a substitute for professional medical expertise or treatment. Your healthcare provider is the best person to inform you of your health risks and recommended behaviors during the COVID-19 pandemic, as they'll be the most familiar with your specific personal health. I'm now very excited to introduce the panel of experts. When I introduce you, if you could each unmute and make sure your video is enabled and say hello to everyone so we can see your face pop up and you can be recognized. First is Dr. Mark Zabel. He's a professor and associate director of the Prion Research Center in the Department of Microbiology, Immunology, and Pathology, and research associate dean in the College of Veterinary Medicine and Biomedical Sciences at CSU. He earned his PhD in experimental pathology and microbiology at the University of Utah and postdoctoral training at the Neuropathology Institute, University Hospital of Zurich, Switzerland. Next is Dr. Marissa Bunning. She is a professor and extension specialist in food safety in the Department of Food Sciences and Human Nutrition at CSU. One aspect of her research focuses on food safety communication. Next is Dr. Deanna Davalos. She's a professor and licensed psychologist in the Department of Psychology at CSU with a research program investigating cognitive aging and community-based interventions for older adults. She's also the director of the Aging Clinic of the Rockies and associate director of the Columbine Health Systems Center for Healthy Aging. Dr. Bob Ellis, emeritus, is a professor and the director of the Biosafety Office at CSU. He's responsible for establishing protocols for safety and security in Colorado State research laboratories that investigate bacteria, viruses, and other infectious agents with the aim of preventing, treating, and curing significant global diseases. Dr. Sue Schneider is an extension agent with the Larimer County office of CSU Extension. She provides leadership and programming in the areas of community, health, and healthy aging, and is the director of Senior Access Points of Larimer County. And last but not least is Dr. Rebecca Jackson. She is, sorry, my notes just went away. Dr. Rebecca Jackson is a geriatrician at Front Range Geriatric Medicine and currently works in the post-acute and long-term care settings at Columbine Health Systems. She also serves as the medical director for the Columbine Health Systems and has been part of 3 nursing home outbreaks, including the first outbreak in the state of Colorado. She continues to work closely with Columbine for their COVID policies and procedures. Behind the scenes, we also have Hannah Hallisker, who is the Center for Healthy Aging's Communications and Outreach Coordinator. She will be in the chat monitoring all the questions and will moderate that later. We also have Jim Becker with Senior Access Points, Karen Hamilton, who's the Associate Director for the Columbine Health Systems Center for Healthy Aging. Thank you so much to everybody. You were super helpful in arranging some of this, and we're excited to have you be part of this. Without further delay, I will move on to the first question. And our first question deals with food and diet. So we don't hear enough of how to build our immune system. I would like to know what we can do to help fight off or reduce effects of COVID. Perhaps there are non-traditional aspects to be discussed rather than suggesting eating foods that actually cause health problems, like inflammation-causing foods, wheat, gluten, milk, grains, etc.
Thank you, Rally. So I will start trying to answer this. It may not be all that satisfying because it's really things that I'm sure most of you have already heard. And it's kind of basic, boring stuff, but it's actually quite effective in making sure your immune system works the best way that it can. And these are things like getting enough sleep, eating a balanced diet, reducing the stress that you have as much as possible. All of these things will help your immune system work optimally. If you're relatively healthy, those are the basics. There was some mention about eating or avoiding different foods that might cause inflammation systemically. Those things are more specific to individuals that may have a gluten intolerance or have an autoimmune disorder that it causes systemic inflammation and those types of things. And in those instances, again, I'm not an MD, so I would recommend you talking to your physician. But those individuals may have some special needs to help their immune system work the best that it can. But really, basically, it's get enough sleep, try to reduce your stress level, exercise, and get a nice balanced meal.
And I'm just going to add, those are excellent points. I'm so glad that this question was asked because a strong immune system can help us in so many ways. And so we really need to think about what we're doing as far as supporting our immune system. And that's kind of falls along the line of self-care that we hear about. So especially these in stressful times becomes really important. And I'm going to put a link in the chat box to just a list of tips that are all the things that Mark mentioned and that go into a few more details and other resources.
Thanks, guys. In a similar vein, I've heard that vitamin D is important to protect us from COVID. Why is that? And how much should you take?
All right, I can try to answer this. I actually found and I'll try to share it over here in the chat, a little article from the Lancet that talks about vitamin D and COVID. And they talk in here a little bit about how, using vitamin D is for respiratory infections actually dates back to the 1930s. They looked at cod liver oil back then. And it's some thought that it has an anti-inflammatory type effect. And the barrier currently is that we don't have a lot of good randomized control studies about it. So, and the other trouble is too now that they're using dexamethasone for treatment of acutely ill people in the hospital. So it's hard to distinguish the effects of that because it's very much an anti-inflammatory property compared to vitamin D. So in this little article I'll share with you guys, they talk about, they might focus more of their studies based on the community dwelling people to look at the benefits of it. Really, it is a fat soluble vitamin, so you want to be careful. You don't want to take too much of it because you can develop toxic levels, but the recommended dose is 800 units daily here for the United States. And that states that in the article 2 for you. Usually if you take 1,000 to 2,000, it's typically okay. I have seen people have toxic levels if they consistently take 5,000 or greater daily. So I will share that in the chat so that you guys can have that. I don't know if anyone else has anything else to add.
Rebecca, jumping off of that, we have a question in the chat that people with darker skin are more likely to have low vitamin D levels. Is this true? And how do we know?
You can get lab testing to look at your vitamin D level. Insurance doesn't always pay for it, but you can get it done. And usually getting a level above 30 is recommended if you can get it up to the 40 to 60 range. It's amazing, even in Colorado. Certainly when I was in Portland, everybody was vitamin D deficient out there. Just there wasn't a lot of sun exposure. And even here in Colorado, I do see a lot of my residents because they are outside a lot. And a lot of us are wearing sunscreen now too. So, taking that supplement every day will help prevent that from happening, from getting low vitamin D levels.
Yeah, just to build off of what Rebecca was just talking about, photoactivating vitamin D is required, right? And that's why people who don't get enough sunlight have vitamin D deficiencies. So there could be a link here to the amount of melanin in individuals with darker skin that absorbs more of the UV light required for photoactivation, that makes it less available to photoactivate your vitamin D. I'm not aware of studies that look at this specifically, but that's, I think, a plausible explanation for that phenomenon.
And I'm just going to mention that I put some more links in the chat. And vitamin D is such an interesting nutrient. It's not found in very many foods, and we can synthesize it, but we can also obtain it from our diet. And it's hard to know if you're getting a sufficient amount. So I just encourage you to follow up and read about it if you feel like you might be deficient. Surveys show that a fairly high percentage of the population in Colorado does experience a deficiency.
Thank you. All right. Is it safe to eat out at restaurants if you're in the high risk group? And why can't you get it from food?
Okay. Sorry. I'm really glad that question was asked also. And evidence is helping us understand that food that's prepared at restaurants, food that we buy at the grocery store, has not been strongly associated with the spread of COVID-19. That is, everything is pointing to person spread. But if you are eating out in a restaurant, of course, you're going to be around many other people. So kind of in answer to this question, I would encourage everyone to think ahead through the situation. If you were considering going to dine-in restaurants, and I realize that it's really fun to go out and have meals that someone else fixed instead of staying at home and eating your own cooking and things. But if you think through and you're not sure what the situation is, you may want to find out if that there's outside seating available where there's better air ventilation, or whether seating is only indoors, and how the spacing of tables and chairs is set up. Restaurants are following the precautions, the public health precautions and regulations that have been given to them, but there's certain things that really can't be controlled, and if you should be trying to follow that 6-foot distancing. And in entryways or waiting areas, that can be difficult. So if you think through the situation and feel that you're not going to be comfortable there, you may want to reconsider and think of alternatives like picking up food or having food delivered, and still enjoying it with friends and family, but doing it in a table in your backyard or at a table at the park or something, instead of going into a situation where you're not sure what, how much you'll be able to follow the distancing recommendations.
I was just going to add, I thought that was an excellent answer, Marissa, and I don't have anything to add about that. But the other question about why we don't get it from food and why most viruses typically are not foodborne, because they can't survive by themselves like bacteria can. And bacteria love the food that we eat, and so they can grow in the food that we grow and that we make. Viruses require to be inside of a cell, in our cells, to grow, and food, once it's prepared and served, viruses typically aren't in our food at those types of levels that could survive. Additionally, when we ingest food, so foodborne illnesses are different than respiratory or other mucosal infections in that they have to survive our stomach acid. Right, and so most viruses typically are not infectious through the oral route, through the gastrointestinal tract, because of the low pH in our stomachs. So that's typically why. Now, the reason we cover our nose and our mouth is because virus can live inside of our oral and nasal cavities. That's different than the environment in our stomachs. And so one could pick up virus in our mouth. If we swallow that virus by drinking water or eating, the virus isn't going to survive in our stomachs, but it can survive in our oral cavity and then infect the lymph nodes in our head and neck.
All right. Moving on, we're going to have a couple questions about vaccination. How effective is a vaccine likely to be? When will it be available?
Well, I'll jump on that one to start with, and then if others have comments, that would be great. The vaccine, the only thing that we can say about the availability of the vaccine is what we're hearing on news and also what we're reading in the scientific journals. And it appears that it's going to be a few months still before vaccine would be available for the general public. The testing that's being done is really moving as fast as absolutely possible in order to get these vaccines available as soon as possible. And the effectiveness also has to do a lot with the availability of that vaccine. Even though we've heard that there are a couple vaccines that are in some of the clinical trials, the third or so stages of clinical trials, we still don't know the overall effectiveness. They're looking very, very promising, but there could be something that would not work out in these trials of many thousands of people, and therefore then take those vaccines off of the fast track. So we just have to wait and see the next developments, but it's looking very promising and very hopeful that we could have one by the end of the year or shortly after that.
Thanks, Bob. I totally agree. A lot of the vaccines that are making their way through the clinical trials do look very promising. And so, phase 1 is typically, is the vaccine safe? And is it effective in laboratory animals? And then they assess additional safety in phase 2 trials, and they look at in humans. And so then they look at the immune response, right? So is it safe? And are you generating antibodies? Or some of you may have heard of another
I think Mark was going to talk about cell-mediated immunity. Mark, continue. Yes. You had a glitch right there.
Oh, sorry. Yes. So that's where I was. Oh, can everybody hear me?
Yeah, I can now.
Okay. Mm-hmm. Yes. So that Oxford vaccine has two different immune responses. One is the antibody response, but also maybe even more importantly, it generates a cell-mediated immune response, which means it generates these specific T cells that can kill infected cells. Again, remember, viruses infect our cells. And so the immune response is important for identifying those infected cells and killing and eliminating them. So vaccines that can provide both arms of that immune response, antibodies and cells, are going to be more effective against the virus. But we don't know the effectiveness of this yet, right? So phase 3 is really the proof of the pudding, right? So they're gonna vaccinate individuals and then expose them to an infection. And that's when we'll find out how effective it is. And if vaccines can give us, greater than 60% protection, a typical flu vaccine will give us at least 60% or greater, and that we know that can provide us with that herd immunity that we're looking for. If these COVID vaccines can provide that, man, then we're in business. But we just don't know right now. Right now, we know that the vaccines in phase 3 are safe and they're generating antibody responses, and some are generating that other cell response too.
And I think I'll just jump right on into the next question. And the next question has to do with how safe would I feel getting a vaccine that's been fast-tracked through the FDA approval process? And would I personally really want to wait until some other people are vaccinated? Well, even though it's a fast-track system that we're looking at, I don't think you need to get too hung up on the fast-track part of it, because there are thousands of people who are being vaccinated with these vaccines, whichever vaccine it is. And those thousands of people, the studies must still prove safety and must still prove efficacy, so that once it's approved and once it's available for the general public, I really would feel very happy to have that vaccine available. I want to be about first or second in line to get that vaccine. I don't have very many worries at all. Of course, though, I'd want to see what any contraindications are. If there have been some contraindications, I'm in the age group, mid-70s, and a few other issues that I want to make sure it's definitely safe, but also I want to get vaccinated because I think that'll help protect me and help protect those around me. I think the vaccine, once it's released, the vaccine should help us keep a lot of people out of the hospital, a lot of people safe, and should really, as Mark said, start to lead us toward that magic that we keep here talking about, herd immunity, where we have enough immunity in the general population that we slow down the progress of the virus.
I agree. I agree with what Dr. Ellis just said. It's going to be important to make sure that we have a large enough cohort of people getting these vaccines and span the different demographics, including age, sex, race, because we know that immune systems can be different as we age. Immune vaccines may not potentiate or stimulate an immune response in immunocompromised individuals that don't have a good immune system. And so if you're in one of those groups that have a compromised immune response, that's something that you have to weigh when you're deciding whether or not you want to be vaccinated. I think that getting the vaccine into as many healthy individuals with robust immune responses as possible is vital, because that will help us, as Bob said, stem the spread of the virus in the general population. But if you're relatively healthy and have no known issues with your immune system, I would definitely, say that you're a great candidate for receiving the vaccine. If you have underlying conditions where your immune system doesn't work as well, that's a personal decision that you'll have to make about getting vaccinated early. hopefully we can get enough vaccinated individuals to start stemming the tide with herd immunity.
Yeah, and let me follow up on that with the comment that this should be not just your decision, but your decision made with the advice, the expert advice of your primary physician and other physicians that you may be, whose care you may be under. Talk to the people, the medical professionals, and they should be watching what's going on. They should be the person that knows best about your immune system, about your ability to handle another vaccination, and they should be watching what's going on with these vaccines so that when they become available, that's the person or that's the team that can really give you the best advice on this.
Absolutely. Thank you for following up, Bob. That's critically important.
All right, we're moving on to schools. If a primary caregiver is over 60 and caring for a school-aged child, would you recommend sending the child back to school or doing homeschool with the child?
All right. We definitely had a good discussion about this as we were getting ready for the webinar. I think school is something that's weighing heavily on the minds of everyone right now. And it's so hard because it's a very fluid thing right now. It's a moving target. And we don't quite know what's going to happen in September and what that's going to look like for all of us. So, you know, they were talking about talking with your physician, and this might be a good place to also go back to your doctor and just talk with them about what your personal risk factors are, and if it would be, you know, kind of processing through that with them, what the best option is for you and your family. Certainly, if you have higher risk factors, you might consider the homeschooling. I also realize, though, that puts a tremendous caregiver burden. A lot of us aren't teachers. So that it is a complex decision. And I think you also have to look at what your specific school is doing. One of the questions we got was what the schools are doing to protect our kids as they return. And it does seem to vary a little bit. The states put out, I think they have like over 40 pages of guidelines. The county put out some guidelines as well. So there are some basic things that they're asking them to do, but it might be variable depending on what your school is doing within the district. I don't know if anyone else had any thoughts on that too. But yeah, it's something I'm still struggling with myself. We just found out last night what our school's doing, and so but it could change in a month too. So, you know, having plan A and plan B, I think is going to be important.
In that similar vein, do you know what some of the elementary and middle schools that are local are doing to help protect from contamination?
I know some schools are putting up plexiglass. So they're putting plexiglasses into the room. I think the requirement is 10 years or older are required to wear a mask, but they are encouraging all school-aged children, if they are able to, wear a mask when they return. At least at our school, that's what they were looking at doing. So, and I know schools have been revamping their ventilation systems, and they are looking at how they're going to deep clean every night when the kids leave, and just basic things of like, how do you get the group of kids to the bathroom and make sure that they're socially distanced and washing their hands appropriately too. So I know, I mean, I don't envy the job they have. It's a really tough position, and I think they're trying the best they can to figure out how they can protect our kids as they come back.
Just to follow up with Dr. Jackson's comments, so all of that is right. It's changing sort of daily. One of the things we talked about is really school districts are doing different things, and schools are addressing it in different ways. And like Dr. Jackson said, it's really sort of been changing on either a weekly or bi-weekly basis in terms of what's happening with COVID. So It's really important if you do have kids at home that you are following up with the emails that are specific to your school. A lot of what comes out of the schools is asking parents for input. And so if you are a parent or a grandparent or a care provider of a child in school, it's really important that you give them feedback, because they are also trying to customize what they're doing based on what the parents at that school want. And part of the reason that it changes is there are virtual options, and that changes from month to month. How many parents seem to be interested in having their kids in all virtual versus partial in person. So there's not a blanket response. Just like Rebecca was saying, there are rules for all the schools, but it's really important if you want to know what's going on at your school, even if it's a ridiculous number of emails and it can be overwhelming, that you're keeping up specifically with your child's school and that you're giving feedback to the school.
And I'm hopeful that this fall will be a little bit different from what we saw in the spring. I think schools really, our school does not do a lot of technology. So it was really, they put it together as best as they could on very, very short notice. And I think they've at least had the summer to try to prepare, and they're working on things to kind of be able to stream those classes live if you are at home. I know there are attendance requirements, so I think it's going to be a little bit more robust this fall. So hopefully that'll be helpful if you do elect to keep your kid at home. That'll be a little bit more supportive for you.
Okay. The next one says, I'm so distressed by the administration's insistence on opening schools and curious how they're going to handle that locally. We covered that a little bit. I have a nonprofit that serves needy families of school-age children, and we're struggling with how to provide services when schools reopen.
So yeah, that's a difficult question, and when we were discussing this in our pre-meeting, we weren't exactly sure what this nonprofit does and who it serves. So if there is someone who asked that question on this meeting, if they want to try to clarify a little bit what they were asking, that would be very helpful. So I can try to answer this a little bit generically. So if you are a member of a nonprofit that provides meals or in-home care or services to individuals, you should be taking precautions to make sure that you keep those that you're caring for safe from you. This is assuming that you as a caregiver for this nonprofit are relatively healthy, and the people that you are caring for maybe not as healthy. So again, it's very important that you do the basics. Wear a mask, distance as much as possible, wash your hands, don't touch your face, encourage those you care for to do the same while you're interacting with them. And in lieu of more specific information, I would just recommend those basic things again as caregivers. You want to make sure you're protecting those you care for from yourself. Those that you care for are likely more homebound than you. And so you are likely in contact with more individuals than they are. And so you are going into their homes, and you could be bringing COVID or SARS-CoV-2 with you. So it's really important that you take precautions to protect those you care for from you.
Thanks. So we're going to move on to transmission. Is it safe to travel by car around the state using gas stations, restaurants, and hotels? What precautions would you advise?
I'll start out with that one and then others can jump in on it. But basically, I think it's quite safe, but it's as safe as you make it. And that's, you can't rely on everybody else following your standards. So you set your own safety standards. You know, when you pull up to fill up with gas, you can usually do that all by yourself. You don't need an attendant to come out and help with that. Use your credit card at the pump. You can do all kinds of things there to minimize contact with anyone else. Restaurants, most restaurants are now using some distancing practices as well as cover practices. And this question specifically said around the state. So let's say that they're traveling around Colorado. However, if you go to adjoining states, they're not going to have the same types of safety practices that you might be used to here in Colorado. So again, take care of yourself. And you're probably going to want to go into grocery stores to get some groceries if you're going to fix some of your own meals. Hotels, I know some people that have traveled in and out of the state have taken enough wipes with them to wipe down everything, although most of the hotel chains say that they are doing that as a precaution for people. Take a few added precautions. It appears that the COVID-19 virus, or the SARS-CoV-2 virus that causes COVID-19 disease, really doesn't survive all that well on these kinds of surfaces, inanimate surfaces. What you really need to protect yourself against is that direct transmission from someone else who may or may not know they're even in the transmission stages of the disease, or they may be totally asymptomatic. They may not be ill, but still be able to transmit. So protect yourself against that. And those are the precautions that I would say. I know people might think, well, should I protect my hands? Should I do this? Should I do that? I think if you protect your respiratory system, which is your nose and mouth, your upper respiratory system, like Dr. Zabel has mentioned before, that is really the critical part of protecting yourself in these travels. A friend of mine that went up north from Colorado through Wyoming into Montana a month or so ago said that she was about the only person in a lot of places that was wearing a mask. But again, you're protecting yourself. So take that into consideration.
Totally agree, Bob. Great answer. I would just also mention that personal vehicles are among the safest, probably the safest mode of transportation that you can take when compared to public transportation like planes, trains, buses, those types of things. Traveling in your own car is really the safest way to travel around.
Okay, and then we'll jump on into the next question. And a person that is asking this question says, as a physician, I thought a person had to develop the infection. In other words, they're replicating the virus within their own body before they can really transmit the virus, this particular virus. And when we talk about the virus here, make sure that you're taking this specifically as the SARS-CoV-2 virus, COVID-19 disease. We're not talking about other viruses. There are other viruses that have different mechanisms and means of spread, different times during infection. People with other types of viral diseases may almost always be symptomatic. Very, very few people be asymptomatic. And the transmission may only be when you're symptomatic, or it may only be after you become symptomatic. Anyway, here we have some variables, and there have been known cases where people are totally asymptomatic throughout their carrying of the disease or of the virus in their body. They don't have the disease, they've got the virus, but they're still able to transmit. And so this goes back to what we talked about just earlier, and that is take care of yourself. It's good if other people around you are taking care of themselves, which in turn helps take care of you too. But make sure that you're taking care of yourself, and make sure that you're taking into consideration the transmission and spread of this virus. This virus, we don't know the exact infectious dose of this virus, but it's not one virus. It's not 10 viruses. It's not 100. It's going to be hundreds, thousands, tens of thousands at least, usually, that you would get exposed to at one particular time. So that's what you need to protect yourself against. And that's why some of the masking techniques that we see, covering your mouth and nose with good cloth mask, has been shown to help. So I'm going to leave it right there. And it looks like Dr. Jackson has some more to add to it.
I also got a good question in the chat that I was going to share with everybody. Yeah, what they're currently doing with the, if you have like a high risk exposure, say you're exposed to somebody without wearing masks, and they turn up positive for COVID, you have to isolate, self-isolate and quarantine for 14 days. And I think that comes from, there's some data on the CDC saying about 97% of people will become positive within 11 days of exposure. And you're totally right that some people have no symptoms. We've definitely seen that. Or if they do, you can have a pre-symptomatic phase where you're shedding the virus, you just don't know you're sick yet. So I'm gonna share the chat question. The question was, we have limited access to testing and it can be expensive, especially for the uninsured, but we know that COVID carriers may be asymptomatic. Is it worth getting tested now and then, even if no symptoms? And, like people who have resources, they are getting tested more often, and where the poor populations and underserved don't have, access to that as well. Yeah, and frontline workers, post office, etc., should be high priority. Yeah, the testing is challenging even when you have access to it. I mean, the CDPHE lab is doing a great job right now trying to ramp up their capacity to do testing. I mean, we're at nursing homes, we're supposed to be testing our staff weekly, and right now the testing results are taking 4 to 6 days to come back, which is really hard to isolate staff and those kind of things. So until the testing does get better, it is a challenge and it is expensive. So I think that is also a huge barrier for people just being able to go and get routine testing. Hopefully we will get to a point someday where we can have rapid testing and people, like, you can feel safe about seeing your loved one. But until those times, using those basic measures to kind of protect yourself, and the masking is really, it's great. So I would encourage everybody to use your mask because it is effective. It's a good question. I don't know if anyone else has anything else to say on that.
Thank you, Rebecca. So I was just going to follow up with a couple other parts of that question to finish it off. One is the timing of the test. And the question was, it seems that people are encouraged to get tested immediately after contact, and that might be too early. And the question was, doesn't the virus need to replicate for a while before you'd be able to detect it? So I think a typical scenario here would be that if you are potentially exposed to someone who's infected, you probably aren't aware of it immediately. It probably takes a few days before somebody contacts you and says, hey, look, I've tested positive and I wasn't around you. That's part of the contact tracing. So it's likely to be several days to maybe a week or more before you are notified that you've been exposed, right? That's a typical scenario. And so that's why I think most people say, okay, you need to go get tested right away. Having said that though, if you're not aware of when that exposure occurred, I would recommend getting a test then immediately. And if it's negative, as Dr. Jackson said, you need to quarantine for 14 days or until you are tested. I would, even if on a initial negative test, I would get a second test if possible a week later. If both of those tests are negative, you're probably in the clear, right? But I think that's a typical sort of timing that would occur for someone who's been exposed and needs to be tested. And then the other thing is absolutely right. As Dr. Ellis said, it takes thousands and thousands. We don't even know what the infectious dose is yet, but it's certainly more than 1, 10, 100, or 1,000. Once an individual is exposed and is infected, it's going to take a while for that individual to start replicating the virus before it can start shedding the thousands and thousands of virus particles required to infect someone else. And so that's a typical sort of infectious course as well.
Okay, Dr. Jackson, did you have more to add to that?
Nope, I was just gonna say you're totally right. That's what we do as far as like if you have an exposure, we do at least 2 rounds of testing at 7 days apart. So the 2 tests is absolutely right.
Okay, well, let's jump right into the next question that's in this little group of transmission questions. And it has to do with transmission from a human to a dog or a cat, or vice versa, from dogs and cats to humans. So I'll take the first stab at that, and then others probably want to give some answers too. But number one, can a human give it to a dog or a cat? The answer is definitely yes. That has been proven in several different instances, not a lot, but several. So probably some instances that we don't know about, but dogs and cats have been shown to be positive, and the only exposure they had, since they were indoor animals, was traced back to their owner that had very close contact with them when the owner, the person in the house or people in the house, were COVID-19 positive. So that was the only chance that those animals could have received that infection and that exposure that led to the infection. Now, the flip side of it, can dogs or cats transmit this back to humans? The answer there is kind of a guarded yes. It probably can happen, but is it realistically going to happen? And that answer is usually going to be no. And I'm not going to say absolutely no. I'm going to say usually no, because there probably will be some dogs or cats that will have an underlying situation, such as an immunodeficiency or some other lack of response that may allow this coronavirus to multiply in them to where they could transmit it. But that has not been shown to have been the case in the different instances where I've read, and not just in this country, but in other countries. Now, if we take this a little bit further to a different species in several different countries, Spain, Denmark, the Netherlands, there have been outbreaks in mink farms, and these mink farms are thousands and thousands of mink, and they have been shown to be quite susceptible to this virus. They most likely got it from humans who were infected, and then it has been shown that there have been a few humans who have been infected back from the mink that were positive. In our country, we don't really have these levels of mink farms or those types of exposure opportunities. So if we're just talking about the normal household pets, dogs and cats that we would usually see, the chances of that being a vector or being a mechanism of infection to the rest of the family is not great at all. It's not zero, but it's close.
Great answer, Bob. We had a follow-up question in the chat about whether or not horses are susceptible. I don't know if horses are susceptible. I do know that livestock are being considered. I know that CSU has a team that just received a grant from the CDC to start testing livestock in the Navajo Nation, doing some surveillance to see if livestock can test positive among other animals on the Navajo Nation too. But as of right now, Bob, do you or anyone, do you know if horses have been tested yet?
No, I have not seen that horses have been tested, but here's one thing that we should remember, and definitely remember, that there are hundreds and hundreds and hundreds of coronaviruses. So if somebody says that, well, this pig was positive for coronavirus, or a cow was positive, or a horse was positive, all these animals have coronaviruses that they are susceptible to. Whether or not it's going to be the SARS-CoV-2, to my knowledge, the only ones that I've seen have been some zoo animals that were cats, large cats, and that was really rare. but then also a very few dogs and cats that I've seen on international infectious disease news, and then these mink farm outbreaks. That's all I've seen so far. How would a horse get exposed? Then you have to take that into consideration. Look at the chances of cats and dogs getting exposed, the intimate contact that people have, nose to nose, face to face, slurping and licking and all of that. Man, that just turns me off. But some people, that's how they communicate with their pets. So if that's the way you communicate with your pet, and if you're COVID positive, you might not want to do that at that particular time. So keep that in consideration. Somehow those animals have to get infected. And I don't really see a lot of it happening and being outbreaks in other animals, but haven't tested that.
Guilty. I let my dogs lick my face all the time. I should probably stop that. I just wanted to point out that Hannah posted a link that talks about equine COVID is different than COVID-19. And as Bob mentioned, there are a lot of different coronaviruses that are more species specific. But what we're concerned about is that SARS-CoV-2 is new. And so we don't know all of the mammals that might act as reservoirs or vectors. And so we still don't know about horses.
So we only have about 8 minutes left. I think we're going to transition to the last couple questions about mental health. So tossing it back to Allie.
Thanks, Hannah. So I have been fighting with my spouse over so many things related to COVID. We disagree on things to a degree I haven't experienced before. How do we work on keeping some peace over disagreements?
Well, we have a couple of questions that about mental health, and I'll bring in part of the other one. I think most of the folks who study mental health related to COVID, one of the big things is to maybe limit how much time you and your spouse are following up on COVID. And what I mean by that is you really don't want to be just inundated 24 hours a day. So part of that is maybe not, if that's what the arguments are about, maybe limiting how much time is spent. I'm a big fan of setting up ground rules when there's any sort of thing that's causing tension in relationships. So saying, we're not going to talk about this, or we will only talk about this for 20 minutes before dinner. But coming up with something to where negative topics or topics that you don't agree on that cause friction are maybe minimized, or just there's some rules that you're not dreading this coming up every day. In terms of just regular relationship arguing, I think we've talked about this panel after panel that everyone's anxiety is a little bit higher now, and so there's a little bit less of a buffer in terms of relationships and getting along with your family and friends and spouse. Just because we're low on time, I would really sort of suggest that anybody who's dealing with stress or tension or not feeling like they're doing very well in these times, keep a few things in mind. So getting back to the exposure, generally we tell people try and come up with 2 times a day that you will look at the news about COVID, and that's it. Maybe 1 in the morning and 1 in the evening. I think there have been some excellent points made that there's a lot of false news or misinterpreted, or it's overwhelming. And so try and pick a source that generally is considered to be pretty reliable, like a CDC website. And people have said maybe do a CDC in the morning and then your local news at night, and that's it. And then in terms of other mental health, I've said this repeatedly, and I still think it's really important to come up with some sort of routine or structure, to come up with a list of goals of things that you want to do on a daily basis, just so you're not feeling sort of drowning in this. A lot of folks will say, I just want to get through this and return to my life. And it's really important that you find ways to connect and to do sort of meaningful tasks during COVID and not to wait. So some of the really important ones I think are exercise. These have all come up. Dr. Zabel brought these up. Sleep is really important, minimizing stress, healthy diet, exercise. I will mention that the Center for Healthy Aging is going to be doing a program that's free for folks who want to get a consult about exercising that they can be doing at home, nutrition information. There will be some free support groups in terms of social isolation. CSU also offers mindfulness classes for free to the community. So I think really spending a little bit of time every day saying, what am I going to do that makes me feel good or that's something that I enjoy? If you have any chance to get outside of your house, like in your backyard or to garden, we know empirically that being a part of nature is very, very important. So doing things that relieve your stress, but in terms of fighting with your partner or arguing with your partner, if it's COVID related, I think there has to be some ground rules. If you need some help coming out with ground rules, there are all sorts of mental health professionals that can meet with you or meet with you and your spouse about this is what it looks like to establish ground rules in a relationship, and then stick to them. And then also just really, again, getting into this idea that you're going to try and have a bedtime, kind of a wake up time, a time that you do something that's physically healthy, a time that you do something that is either mentally, spiritually healthy, but putting it down on paper and doing it so you just don't start to feel like you're just getting lost in these ongoing COVID times.
Thank you, Deanna. If anyone has a quick question that they'd like to ask the panelist, we have just a couple more minutes left.
Yeah, and I just wanted to point out, I put in the chat box, the Senior Access Points team has put together a really comprehensive list of educational and well-being resources, anything from chair yoga to Senior Planet classes to OLLI classes, and gardening options through extension, anything you can imagine. There's so many wonderful resources out there. So there's a link to the website, larimerseniors.org.
Thanks, Sue. All right, so looks like that's all the questions we have for today. I'd like to thank our experts again for sharing their knowledge and time with us today. The recording of this webinar will be available for viewing soon, hopefully by tomorrow, and we will send the link to everyone who's registered and make it available on our center website. And of course, if any of our community partners wanted to share the link as well on their websites, they are more than welcome. Thank you so much. I hope everyone has a good rest of your day.